Good afternoon, everyone. You're all very welcome. We're just going to wait for another couple of minutes. There's still some people joining, and then we'll get started. Hi there, everyone. Just double checking that everyone can hear. Um, we're just we're waiting there for a couple of people coming in. Can everyone hear okay now? Perfect, perfect. Great. Getting all the notifications now. Perfect. We're gonna maybe just start. I think everything's kind of calmed down with people joining now. So we will just start. So I'm delighted to welcome you today to our free webinar on safe transitions, so moving and handling risk assessments for mobile shower chair commodes. It is sponsored by Pausicare, and Norma will explain a wee bit more about that as well. So today, this webinar will be hosted by myself, Adele from A1 Risk Solutions, and of course, Norma Findlay, our Head of Clinical Operations at A1 Risk Solutions. Um, and do not worry if anything happens technically, it is being recorded. So we will have the recording for you. It will be sent out on an email post webinar, and then it will also be available online to be able to see afterwards. Within that email, you will receive a complimentary blog as well, and that'll be assessing mobile shower commode chairs in practice. So that'll be included in that email. So again, do not be worrying if something happens and you have a technical issue or you've missed it, it will be recorded. Also then, if you have any questions for the Q&A at the end, please just pop them in the chat or in the Q&A box, and then we'll run through them at the end with Norma. So on that note, Norma, if you're ready to start, you are welcome to do so.
I am. Thank you so much, Adele, for the kind introduction. Very much appreciated. And thank you all so much for joining me this afternoon. I really appreciate that. I am indeed Norma Findlay. So I'm Head of Clinical Operations at A1 Risk Solutions, and I speak to this session on mobile shower chair commodes. As 24 years as an occupational therapist, I specialise within 24-hour postural care and moving and handling. And I will present some case examples, also some case law, and that's not to put any fear in the minds of anyone or scaremonger. It is just to learn from good practice, learn lessons, and hopefully put into place good practice and good standards. As Adele said, we're sponsored by Pausicare. Delighted to be. Pausicare design and manufacture hygiene solutions and postural care systems. So I will refer to some of their products, and you can ask any questions at the end specifically for for Posicare, who I'm sure will be able to follow up on those questions too. So some of the aims of today's sessions are to understand the safe use of mobile shower chair commodes. So we refer to MSCCs. So that is what we're referring to today. Integrate clinical assessment of function, skin integrity, and safe handling. So we're not just talking about the functionality of mobile shower chair commodes, but also our clinical assessment. We're looking at establishing client and caregivers' roles in relation to MSCCs, and we'll review functional capacity for bowel care and hygiene tasks. In addition to that, we'll look at safe transfer methods, including hoist, stand aids, and transfers. I do talk to my experience of as a community occupational therapist and working within hospitals earlier on as well, and working with children and adults and into older age as well. So hopefully you will find that the aims will be met according to the people that you are indeed supporting in your place of work. So why safe transitions matter? So when we talk about transitioning to mobile shower chair commode, not every human being falls into that category of moving from a standard use of WC, toilet, or bath, for example, bath hoist, to a static shower chair and then a mobile shower chair commode. However, there are key transitions that we need to think about and the effect that that has on the person. So many of the people that we work with may, for example, use a standard WC toilet, and there is a high risk of falls where mobility deteriorates, and we see that pivot transfer. So that's one of the common falls that we would see, either transferring from wheelchair onto WC or onto bathing equipment. And that pivot transfer, even if it's replaced with a turner, we see a high number of falls onto the toilet or onto the whilst transferring on and off WC, often because it's a confined space. So when we look at transitioning towards a mobile shower chair commode, we're looking at reducing the risk of falls. It may well be that if it is onto a standard WC, that there's shear and friction there, depending on how the person is transferring. So we'll look at, can we eliminate that shear and friction? And is there a safer method of indeed washing and using the WC function? It needs to have enhanced dignity, comfort, and safety. So that's really where it comes into reducing the risk of falls and having equipment which it provides dignity and comfort. I mentioned 24-hour postural support, which I'll keep coming on to as the webinar proceeds. And that's so key, because if the person requires postural support in their seating system, for example, then we'll look to provide that within the shower chair commode as well. We're looking to improve outcomes in pressure area management in transitions. So it may well be that if the person is spending prolonged periods sitting on the toilet, on the WC, then they're at higher risk of pressure skin tissue breakdown. And I'll mention a piece of research in a second based on those findings. And also the transitions matter because often static provisions such as a standard WC or a static shower chair, we need to look at how that we might reduce carer strain. So if the carer is, for example, helping to mobilise their loved one or the person they're supporting to the toilet or to the shower area, and how that might be done safely. So we'll look at moving and handling practices and the use of handling plans. So hopefully that explains why those transitions are key. Now, it might be a transition due to deterioration, so we'll come on to look at changing need, but that transition might also be because we're working with children and the implications of working on bowel control and encouraging independence. So there's so many reasons that we need to look at the transitions from, say, static to mobile shower chair commodes and the goals for that individual that we're working with as well. So, not to scaremonger, I did say this is not case law, but this is an example of some research. Beware of the toilet, the risk of deep tissue injury during toilet sitting. So in this piece of research, which was published in the Journal of Tissue Viability in 2018, it stated that prolonged sitting on toilet seats involves a potential risk for pressure injuries. Now, this is something which I do come across. It's quite common for me to see, especially in those individuals with spinal cord injury. So there's a tendency to want to be able to use a standard WC because it's something that's obviously familiar to us all, it's easier, and they can continue to use a toilet within other settings as well. However, even in the event that there is padding on the seat of the WC, there is still a higher risk of skin tissue breakdown. And if you look at this, I'll provide references. If you look at this research, it highlights that there is an increased risk by spending prolonged periods of time sitting on the toilet. As it does sound a little bit scaremonger say beware of the toilet, but it's the effects of sitting for prolonged periods of time on a hard plastic base. Now, this is not to say that we don't see this happening on mobile shower chair commodes with the incorrect seat bases, but I'll come on to that in one moment as well. So some of the clinical components of assessing that skin integrity and vulnerability on MSCCs are the same as we would when we're considering on any surface. So those bony prominence, so the sacral areas, ITs, the heels, and all the bony prominences, including the elbows as well, of course, because the elbows will indeed be rested upon the armrests. So how does that affect the person who is using the mobile shower chair commode? And are they already at risk of skin tissue breakdown? So this is something that I'm very familiar with, and many of the individuals that I would support where you just see a slight reddening, but actually what's going on behind that is if the person is spending prolonged periods of time sitting on an inappropriate cushion, for example. So we need to consider that seat base, the surface, and whether the commode aperture is indeed an aperture or a horseshoe. So I'll mention a little bit more about that in terms of the features of the mobile shower chair commode. But the same applies to skin integrity on the mobile shower chair commode as it does on a seating system or in bed. The other factor we need to contend with, of course, is moisture management during showering or bowel care when using the mobile shower chair commode in a shower environment where you have increased temperatures, etc., and increased moistures as well. So the mobile shower chair commode, some of the features that we'll look at, and this affects our ability to prescribe the correct mobile shower chair commode. So overall, the weight of the mobile shower chair commode and the person that we're supporting, the person who is occupying the shower chair commode. I appreciate that that's not always easy to ascertain. So many of the people that we support who have complex needs, it's difficult to get an accurate weight because there's no adequate sometimes weighing scales for wheelchairs. But if we have that safe working load for the equipment, but also what is the combined weight from a moving and handling point of view for pulling and pushing a shower chair commode, it may well be that we need to look at the portability or portability of the shower chair commode. We refer to that features in terms of, well, is it going to be going to a respite centre, for example? In my experience, it's not often that a respite facility will allow for you to take your own shower chair commode into a respite centre. Indeed, they would use their own. However, it might be on holidays, etc. So it's something to consider, and the weight will make a difference in that as well. The seat shape I've mentioned, so horseshoe, aperture, is it front, rear, or is it a full seat? So in other words, when we say a full seat base, that means that it's not being used for commode function, that it is indeed just being used for shower. So the importance of that is determined by, we'll come on to look at how is the person evacuating their bowels. So that will determine whether the shape of the aperture and also the shape of the person as well. The seat cushion is a really important feature. I've mentioned already skin tissue integrity. So is padding what we're looking for? Is it Dartex covering? Is it foam? Or for some of the individuals we support, hard molded is required. Or it might be that we know that the individual has changing needs. So if we need to replace that seat cushioning, that might be what we need to consider in terms of features. The back support, is it rigid or is it padded or is it mesh? So these can be very helpful. If it's mesh and there's some give in that, can make a big difference. As can providing lateral supports, for example. So if we need to provide lateral supports, then that's extremely helpful to be able to do so within a back support. The armrests or the arm supports, are they movable? Are the heights variable? Do we need to remove them to allow for side transfer, for example? Then we look at the features of lower leg supports and foot supports, and whether we need them to be swing away. Now, one of the things to remember with regards to feet support, as with any parts of the bony prominences in terms of heels, the person is not going to have, if it's for showering rather than just toileting, for example, the person is not going to be having covers on their foot, so they won't have coverings on their foot to protect them. So unlike when their feet is loaded on a special seating system, for example, we might need to provide additional padding on the foot plates. Built-in space is a very key feature when we look at the ability to maintain trunk support and reduce the risk of falls on shower chair commode, as is recline angle if the person has any fixed positions there, such as a posterior pelvic tilt. So we'll look at whether we need to have that recline feature or not. And of course, the brakes and knowing how to use the brakes are a key feature in the mobile shower chair commode. This has come up in a case in the past where the person, the staff using the shower chair commode was not aware of how to correctly use the brakes of the shower chair commode. So knowing how to work them and ensuring that they are still effective and they do work. And this is all applied to being used within a potentially wet and slippery surface area as well. So establishing those goals, when we establish the client and caregiver's goals, those will determine all of those features of what we're recommending and how we communicate that with the person. So it's about those SMART goals and how we work with the person on their priority. Is their priority likely to be comfort, privacy, and independence? And as would ours for them, but we're also looking at all of those features and communicating why we would recommend certain mobile shower chair commodes and how they would transition towards that piece of equipment. So, for example, I can think of one individual that I worked with where privacy was key for them, and at a younger stage in his life he was being transferred in his bedroom and out into the corridor, past the front door and into the family shower room, where he was then assisted to shower there. And at a younger age, that was fine. And the caregivers were fine with that. However, later on, once he reached 17, the idea of the doorbell going and the postman being at the door whilst he was being assisted through to the shower chair, on the shower chair, it was no longer appropriate. So his goal was that he was able to be more independent and use an ensuite shower area. And the caregivers was that they would be able to support their comfort and privacy and independence as much as possible too. Sometimes from a caregiver's perspective, it might be for ease of move from room to room. So being able to move the mobile shower chair commode with ease and that there's no resistance there on the carpeted surface, for example. So we've came across carers who have queried whether the shower chair commode can be moved or manoeuvred from room to room safely. And that comes down to a risk assessment again and collaborating those SMART goals, and ensuring that we communicate the clinical safety and the client dignity within that as well. So much like many of the prescriptions of mobile shower chair commode, or indeed seating systems, or any aspect of 24-hour postural care, it's around communicating that and educating so that everyone understands the purpose, and balancing it so that the task is simple but also maintaining function. So establishing client and caregivers' goals is also key to determining what effective mobile shower chair commode is to be provided and why we're recommending that. I'm just going to share another case example with you. So the reason I choose this case example is because Jamie featured on a poster, and indeed he came along to the Stop World Pressure Ulcer campaign back in 2018. So Jamie is, well, at the time, so he'll now be into his 20s, but he was 19 years old at the time, living with spina bifida, and he was referred to OT for a seating assessment following the development of a grade 4 pressure injury while sitting on his power chair. And the scenario had been that he had left school and he then spent lots of time sitting on his power wheelchair. And this is quite common to many of the situations that I would be asked to provide a seating assessment. Is the focus was on, he was on bed rest, so he needed to spend time out of bed. And pre-intervention, when I went along, he had time in his profiling bed with an Oscar mattress, and we pressure mapped that. So that was absolutely fine with regards to his pressure care, and the district nurses and the tissue viability nurse had provided him with the equipment. He had his power chair, but with an inadequate cushion for him, given the fact that he developed the grade 4 pressure ulcer and pressure injury. He had a standard wheeled commode with a plastic seat base. He had a ceiling track hoist, and he had ensuite facilities, shower facilities. So I worked with Jamie in looking at what his goals were. Obviously, his goals were just to be able to get back out and about, but we had to work up to that. So we had to take a graded approach and look at transitioning surfaces. So what could he move on to? And that included a therapeutic seating system to allow him to be able to join his family, for example, for meals, etc. A tilt and space shower chair with Dartex covering, so that gave him the pressure relief that he needed, and also some line supports, because we noticed that he had a deterioration in his body shape even from the months that he had spent in his bed without any protection there. So this was a really good multidisciplinary approach, and it involved looking at, because the referral came through specifically for a seating system, but actually we need to look at holistically that 24-hour picture, and shower chair commodes were absolutely central to that. It often is overlooked in my experience. So one might think that, Jamie might only be spending 15 minutes to half an hour sitting on the shower chair commode, but actually from birth he had always experienced continence and bowel movements, difficulties with those, should I say. So he had to spend sometimes up to 3 hours, between 2 to 3 hours sitting on the mobile shower chair commode. So it was absolutely essential that we provided the correct support, positioning, and pressure relief whilst he was sitting on his shower chair commode as well. So something like a tilt and space mechanism, I mentioned this is what we provided for Jamie, with a mesh base, so it's not being shared, it's being used specifically by him. This one has a harness. Jamie didn't need the harness, but it does have lateral supports. We'll come on to look at the benefits of a pelvic strap in shortly, but also the need for people to understand what the pelvic strap is there for. Often in training, we're asked the question, is a pelvic strap not seen as restraint? But actually, we're not using a pelvic strap for restraint, it's for postural care and positioning. We had the picture on the screen just now is of the crest. So we have the lateral supports, which are extremely helpful. And just this week, I have a new associate who's joined us and said that she found the crest extremely helpful because, unlike some of the other mobile shower chair commodes, where you're velcroing on laterals, which sometimes can be positioned in the incorrect place, that this is just taking away of for some of that errors, if you like, in positioning, and give good support as well. So reviewing current bowel care regimes, this is very important for looking at the usual time and frequency and some of the triggers for bowel movement. It might be that the person I've already mentioned spends 2-3 hours sitting on the shower chair commode for bowel care routines. Some of the people that we support may require digital stimulations or suppositories or enemas. We need to look at how they need to be positioned for that effective bowel evacuation. Many of the people that I've worked with have issues, so they have a neurogenic bowels. So this means that there's an interruption between the brain and the bowels, and this can cause both fecal incontinence, but also can cause constipation too. So ensuring that we have adequate provisions in terms of access to and evacuation of bowels, and how is that managed? So there are challenges around that. It won't be unfamiliar to some of us to come across where the person is, say, suspended in a commode, in a sling over a bedpan. This is going back, but I do know that this sometimes happens. But actually, are we now more looking at achieving a more effective position for bowel evacuation on a shower chair commode, and reviewing the current bowel care routine? Trying to say that quickly, bowel care routine. So being aware of that is absolutely key to those features and prescription of the correct mobile shower chair commode as well. Some of the functional capacity areas that we want to consider in terms of encouraging maintenance of is that postural stability. So the trunk control while sitting, it might be that the person starts off being able to maintain trunk stability and in midline, but with fatigue due to the heat and the temperature of the showering, that they lose that. So they need to make sure that they have stability while sitting. Upper limb reach, so the ability to clean self after bowel care, that involves, are they able to reach, or are we looking at providing some equipment? Is reaching going to cause possible falls from the equipment, or are we asking a carer to support, by which case then we might need to look at specific handling plans for that? I'll come on to mention compatibility with some of our wash-dry WCs, such as the Closomat or Geberit, but ensuring that that person has adequate perineal hygiene is absolutely imperative, because failure to do so can, of course, result in skin tissue infection and damage to the skin as well. Sorry, just a pause there while someone else is joining us. Some of the risks to identify in our hygiene solutions are, as I mentioned, so that overreaching causing falls, and also slipping on wet surfaces. So that will depend on the choice of transfer. We'll come on to look at that shortly. And also some of the safe practices that we might introduce include long-handed aids if the person requires a pelvic strap, and also seat positions for better access. Are we asking the person to assist, so a carer to assist whilst the person is still sitting, or are we giving some guidance on assistance on bed? I'm just going to check, when I let that person in, I can no longer see myself. Can I just check, can you all still see me? I'm not sure that you want to particularly see me, but Adele, I'll ask you as well.
Yeah, you can. Yeah, you can.
You can. Yep. Okay, it's not that I need to see myself, but it's just you can still see me, that's fine. So yeah, providing safe practices is part of the solutions to this. With regards to slipping on wet surfaces, that can be things like PPE, so providing over coverings on shoes, for example, a bit like we used to see at the swimming pool. So reviewing the transfer, so key to obviously A1 risk solutions is provision of training in safe moving and handling principles. This goes hand in hand with 24-hour postural care. And if we're looking at how that person is positioned, we need to do the same thing for on the mobile shower chair commode as well. So are they hoisted? Is all the hoisting taking place within the bedroom, for example? Or is some of the hoisting taking place with track hoisting or mobile hoist in the wet floor shower area? That will make a difference, because obviously if all transfers are taking place within a bedroom and then they're being assisted to mobilize through to the shower room, then we have moving and handling to consider there of pull and push of the mobile shower chair commode. Sling choice is really important. Is a sling designed to be used for showering? A question that's commonly asked is, should we leave the sling in place or should we remove it? And my response tends to be the same as it would be for sitting in any chair, indeed, that has it been designed to stay in place, or is it intended to be removed? So what are the manufacturers intending for it? And that will be dictated by the material. So we wouldn't expect to see a polyester sling to be left in situ when a person is sitting on a standard chair. But we have other factors to consider in terms of sling choice for mobile shower chair commodes, of course, which include how easy it is for it to dry. So sometimes we will see people choosing slings which have minimal material, very little support, but they continue to use it because it's easy to dry. So from a laundering perspective, which we completely appreciate, because often when there's lots of laundering to do, having slings to make sure they're dry, etc., as well, can be another thing to contend with. So sling choice is important, and making sure that we're being clear how we wash and dry the slings as well. Stand-aids, is that going to be used within the wet floor shower area? And how safe is that going to be in terms of the transfer, or are we going to have all transfers within bedroom area? Ultimately, we look at that TILEO assessment. So the same as we would for any moving and assisting task, we'll look at the task. What does it involve? Does it involve going from room to room, or are all transfers taking place within the same room and we're transporting through? Is the individual informed and educated around all the features, including safe application of brakes, any pelvic straps, any features such as tilt and space to assist with reduction in falls? If it is a self-propelled wheelchair, that the individual is educated on how to use the functions safely. And the environment is key, and we can actually set a separate webinar. Suggest perhaps we do at some stage. I do have in mind who would be a perfect guest for a webinar on the environment around mobile shower chair commodes, and ensuring that the wet floor shower area can accommodate safe access to the WC. So that's in terms of space. And other factors are, of course, factors such as if you have identified the correct mobile shower chair commode for that person, access to funding, for example, for assistance to use the shower chair commode if need be. And it can also be tied into environmental changes and ensuring that those take place at a timely fashion as well. Some other considerations I'll come on to mention are braking systems, so check those. Pelvic straps, I'm going to come on to share an example of lessons learned. So where the pelvic strap needs to be fastened, and perhaps where there's been a failure to apply straps, The pelvic strap is not just around safety, it can also assist with positioning, adjustability, so that's in terms of footrests, compatibility with the wash dry WC. I've mentioned that it might be that we need that calibrated. So if it's to be used over the WC and it's a wash dry toilet, we're thinking about how is the switch going to be activated to wash and dry that person to ensure cleaning and infection control is considered as well. So I'm just going to share one example before I summarise the key points in risk assessment, and that comes from CQC. So this was an extremely unfortunate accident, to say the least, which took place, a critical issue in June 2016. And I report this from CQC website. Two carers, workers, were supported a 62-year-old man to take a shower using a shower chair commode. The shower chair fell forward whilst he was loosely strapped in, and the man, who had Down syndrome, epilepsy and dementia, had a severe learning disability, fell and sustained a spinal injury. Staff tried to resuscitate him, but he died in hospital. And this is an extremely awful case where we have a fatality and what is called an avoidable harm. So it was avoidable harm, and I'll look briefly at the case. But the CQC successfully prosecuted the nursing home. Again, it's not for looking at scaremongering or fear of litigation. It's for what could have been done differently and lessons learned. So in this case, the care home provider had failed to make sure that staff understood how to safely fit the straps on a mobile shower chair. They had failed to carry out effective equipment audits. And they had also pled guilty to the offence of failing to provide care staff and treatment, resulting in avoidable harm to a person using the service. The court ordered, now I'm not going to pass any comments on the fines. I'll leave that to you to decide. However, my experience is that where the person pleads guilty, there's often a reduction in the fine. Now, moreover, I've been involved in some large-scale investigations dating back to over 20 years. And when it says around equipment audits, we don't see any pictures here, but there are some awful examples of the equipment that are used. And if it was deemed as unsafe, then it's likely that we're looking at something that is really doesn't meet the standard that it should be for the people that they're supporting. The positive steps are that the care home provider did improve standards by ensuring that all risk assessments were detailed, which helped to reduce the risks to people living in the care home. Staff were supervised and appraised and mentored and trained in the equipment, and they had the skills to provide a high quality service, and monthly audits were carried out by the area manager and actions monitored to make sure that they were completed. So a positive result, but an awful incident to happen for that to improve. It might be that those clinical integration of manual handling risks are that the person is not actually able to safely be accommodated within a shower chair commode. So as in chair, it might be that we need to look at in certain circumstances something like a trolley, which is featured here as a horizon trolley. However, you can imagine from an environmental position, so I have worked with some individuals who have required trolley, and within a flat that is quite difficult, or an apartment, or most of the houses that we work in is difficult to accommodate. But we need to look at that functional assessment, looking at skin integrity, pressure and pressure areas, how the person is going to be assisted with moving and handling, and how we reduce that risk, their positioning needs, including pelvic or positioning harness, ultimately so that we can have a care plan that meets those needs in terms of safety, dignity and health goals. So I'm just going to summarise before we have any questions. when we're looking at summary of need, this can be detailed within your moving and handling risk assessment in terms of the individual ability for propulsion. So can they self-propel, or do they require care assistance? So that's your first point, is do they need assistance, or are they able to? So that will depend on, for example, within the Cove range, is it self-propelling, or is it an attendant propelled mobile shower chair commode that we're choosing, that the individual needs. The measurements, that's not just in terms of the person's measurements, it's also in terms of the environment. So can we accommodate the choice of mobile shower chair commode at the WC, for example, or does it need to be, does that need to take place away from the WC? I'll just mention quickly, sometimes we come across this where the person's goals is to be able to use the shower chair commode over the toilet so that the carer doesn't have to empty a commode pan. That's quite familiar to us. However, that needs to look at whether that's suitable for that environment. In other words, can it be accommodated? Postural supports, so considering, does the person need lateral supports? Do we need to look at harnesses or pelvic positioning, headrest, tilt and space, and also pressure relief as well. And obviously transfers, we're thinking about, does that take place within room, or are we moving from standing transfers on to powered stand aid, or indeed hoisting? We look at the duration of the use, so that's part of our assessment. How long is that person? We take the 24-hour clock and we think, how many hours is that person actually spending using the mobile shower chair commode? The shower seat shape and aperture are, we need to look at whether they are adequate in terms of pressure care, but also for bowel management and evacuation. And pressure care generally, not just on the seat base, but on the bony prominences and heels as well, and indeed on the backrest too. Portability and manoeuvrability for carer, that's even within the home, so regardless of whether that's going to be moved out with, is it easy for the carer to move? And probably most importantly, above all, so once you've just documented everything from 1 to 8 there on your risk assessment, we need to consider changing need. So back to the functions of a mobile shower chair commode, that changing need might dictate the need for different features on the mobile shower chair commode. And that's also that's for children as well as adults. The difference being, of course, children are growing. So we will need to absolutely accommodate different sizes. But for children, we also need to consider that they will have their own goals for being able to hopefully reach some level of achievements in terms of continence needs. But the same for adults with progressive conditions. So some of our neuroprogressive conditions, we would consider, while some of the features might not be needed at this point in time, we need to plan ahead, and how will the equipment move with the changing needs of that individual. So those are a summary of needs in terms of application to transitioning needs and risk assessment. This is a list of the references that I mentioned, and I'm happy to share those as well as answer any questions you may have. I hope you found that helpful. And as I say, if there's anything specifically for Posicare, please do keep in touch, and I'll be happy to see if I can answer those questions too.
No problem. Thank you, Norma. So there's just one in here at the minute in the chat from Sophia. So she says the patient is currently using a SAR steady. However, due to the presence of steps en route to the bathroom, continued use of the SAR steady for standard showering poses a significant falls risk. Given her high risk of falls, it is recommended that she be transferred to a mobile tilt and space shower chair, which provides greater safety and stability during personal care tasks. Is this the correct or wrong practice? If you could please guide.
So the recommendation is for a mobile shower chair commode in the shower room, but the access is a problem. Is that what
Yeah,
we're?
I think so, yeah.
Yeah. So what I suppose I would ask Sophia, so what would be the method of would they have two? Is the issue in that obviously you can't transport the individual using the Sarah Steady because of the steps, but would you have a Sarah Steady in the shower room and one in other rooms, or would you change the method of transfer within the shower room? Is that?
Yeah, I'm just waiting to see if she will reply in chat. Nope.
Because
Okay. What we'll do is we could come back to that one
yeah, we can
if we get
definitely
some
come
more
back to
information.
it. It's not, I mean, I can think of a case where we had steps into the bathroom, and that was a significant stumbling block. The risk that did introduce. However, what we don't want to do is ideally, obviously, take away a piece of equipment, which is going to encourage a person to be able to stand when they're still weight bearing. That being said, it might be that we have to have multiple pieces of equipment, but I'm not sure that I'm following that that's the issue. If the issue is that we're having to take away the Sarah Steady because we can't access it, or provide an additional piece of equipment, but I can answer that at a different time.
No problem. And Sophia, please, you can get in touch with us via the email address as well if you want some further kind of guidance and information as well from Norma on that. So the next one then is, do you have a risk assessment template that you use that could be shared?
Yes, I mean, I do. I tend to, we can have a risk assessment for every single aspect. And ideally, I would always encourage one risk assessment so that it is included. However, to make sure that we have taken into account all the features, if we're looking specifically at mobile shower chair commodes, I do have a risk assessment that I'm happy to share with you, and I'll share with Adele, so that if anybody else wants to have a look at that, they're more than welcome to have a look at that too.
Great. The next one then from Lauren is, can you explain a bit more on different seat shapes when you would choose different ones?
Yes, so it really is dependent on a number of factors, and it comes down to the individual. So whether it might be their actual shape, so it might be the shape of the person. So obviously we have small, medium, and we have larger apertures. So there is a risk, and we have seen people, you know, if you provide a large size aperture, which is the complete hole, as opposed to horseshoe, which is open at the front or might be open at the side, that the person can fall through. But when you're deciding whether it's an aperture or horseshoe, or it's a complete full seat base, it really comes back to what are the goals of that person. So if their bowel evacuation is, for example, involves any type of equipment to facilitate bowel evacuation, then that might be to the side. So it involves just chatting through what is the individual needs of that person, and making sure that we take note of that.
No problem. Then the other is from Caroline. Are there restrictions on shower products that can be used, for example, emollients?
Yeah, good question. So I am OT background. I'm not continence or skincare, and I would defer to my nursing colleagues within continence care but certainly in terms of just skin tissue and higher risk for slippery, then yes, but I would always defer to our district nursing colleagues for advice on correct application of skin creams, or indeed any washing products as well.
Yeah, no problem. So from the Q&A box, I have a few here as well. So one is a specification question regarding Posicare shower chair. So it's a client who doesn't have complex postural needs but requires a seat width of 24 inches and width between hinge armrests of 26 inches, whilst maintaining an overall width of 29 inches. Would a shower chair would your shower commode accommodate this? I have only found one other company who can accommodate this.
Okay, well, as I say,
Right.
although ideally it is great if we can have a product which is doesn't have to be bespoke. However, Posicare thankfully do design and manufacture, so absolutely I would provide those dimensions. They are manufactured in Wigan, so it's a UK product. So I would definitely talk to the specialists at Posicare to see if they indeed could meet your client specifications, because there is scope there for making bespoke products. Where we can't find that they're available, despite all the features that are available in other products. So yes, if you want to pass on to one of the local specialists, that'd be amazing.
Yeah. And then do we need to do a risk assessment and safe system of works for shower commode chairs?
I would say it would be integrated within your safe system of work, within your handling plan. However, there are cases where there are certain challenges or complexities within the wet floor area that require more detail. But the answer is yes. It would ideally be positioned as part of that 24-hour care plan, if you like, that mobile shower chair commodes are included, just to make sure. I think sometimes we take for granted that the person who's using the shower chair commode knows how to apply the brakes, knows how to apply the pelvic strap, for example. But if the person needs those features, then yes, we should have in the handling plan that they are to be used.
Perfect. I think that was the last question that I could see there. Sorry if I've missed any. It was coming in from both chats. If there is anything that we haven't covered, or if I maybe missed someone, please send us an email. I'm sure we'll try to get back to you as soon as we can with any kind of information that we can give you. And I just want to thank you very much for attending today. And thank you, Norma, for giving us some really great informative information.
My pleasure. Please do keep in touch. And if there's anything that I didn't answer, then please do feel free to come back and ask any questions. I'll do my best to answer them. But I'm delighted to be able to share in this subject because, as I say, it is part of 24-hour postural care, and it is an area that is not often given the attention that I think it should be. So thank you so much.
It's great. Thank you, everyone. This is kind of a natural end now. So we'll hopefully see you again. There's some other webinars coming up, so please keep an eye out, and we'll send some more information through the post-webinar email as well. Again, it's all being recorded, so it'll be sent through to you. Okay, thank you.
Thank you.